Warnings: the anti-pain method proposed in this DVD does not substitute in any way your medical treatment. It is necessary to keep a follow-up of your treatment and only modify it under your doctor's advice. The supra daul method does not cure the illnesses, but it relieves pain in an effective way. The techniques proposed here are not the panacea, but they are important supports while waiting for consulting a specialist of medicine. As their efficiency has been proven, they deserve to be recognized as much for the patients as for the health professionals. Neither the authors nor the editor are responsible for a bad interpretation of this text or for a self-medication. Legal warning: the treatments carried out to my patients are strictly bucco-dentals. The results obtained out of the bucco-dental area are the consequences of a reflexogenic relation of the teeth on other parts of the human body. The teeth have a spectacular action in the chronic corporal pains. Today, the medical science accepts that the human body design is a whole unit and not the sum of its parts. In February 2010, the GO official newspaper published that the ISO has restored the nobility titles to the dental art, and now it is called bucco-ontological medicine. The supra daul method has as objective to relieve the pain. It is the main demand of people who come to us. Is it still acceptable to have pain in the 21st century? The supra daul method is a method simple, effective, regenerative, that means without medication. Supra daul provides the necessary instrument to relieve with effectiveness and in a lasting way the illnesses of the body, such as migraines, back pains, pain in the joints, dizziness, ear buzzing, stomach pain, and other sufferings that cause daily disability. Our method also has, before each treatment decision, the practice of the patient's complete physical medical examination. And now, some practice. Let's go straight to the point. Serge, who is also the creator of the supra daul method, will show us how to carry out an evaluation. Our therapeutic method is based on 3 pillars. The 3 pillars: evaluation to investigate the cause of the pain, the use of a harmonizer, which is a new medical device made to measure, developed by us to rebalance the body, the net of health professionals to obtain optimal results. The evaluation. Hi, Cecile. Hi, Cecile is a young woman who will show us how to make an evaluation. I will explain the adequate movement and good practices to use. As you can see, we are in a calm room and Cecile is barefoot. If you have a tendency to dizziness or balance loss, you should be obligatorily assisted by a third person. First of all, when we make an evaluation, we begin from the superior part of the head to the toes. Essential: somebody has to accompany you during the evaluation for your security. Cecile, then lift your arm forward, lift the forefinger and slowly get it close to the in-between of your two eyes. Very well. If this exercise causes you pain in the eyes or discomfort to follow the finger or the torsion of the head, then consult an ophthalmologist. If you are unable to carry out this exercise appropriately, it means that the visual axis is disturbed. The head rotates to compensate the visual problems, causing possible pains in the neck, but also in the back. Visual control. A vision problem can change the position of the head and generate pains in the neck, the back, headache, fatigue, and dizziness. We go to the ears. Cecile, snap your fingers once in front of the face, then to each side of the face at the level of the ears. Once each side and at the same time both. Well, a disorder of the hearing can cause problems of the head posture or balance problems. In that case, you should definitely consult the ENT specialist. Hearing control. A hearing problem can cause dizziness, balance loss, muscular tension, neck pain, alteration of the position of the head. Test of the jaw muscles. Cecile will put 3 fingers in the masseters. The masseter is a muscle that you feel when chewing. The test consists of pressing and loosening the teeth slowly. If a muscle contracts before the other, consult your dentist. This problem can be the cause of headaches, pain in the jaw, dizziness, ear buzzing, back pain, and cracking of the teeth. Let's test the temporal. The temporal muscle is the muscle that is behind the eyes and above the ears. Cecile, you will put the 2 hands in the temples, pressing and loosening your teeth little by little. You may find a simultaneous contraction or not of 2 muscles. If you find that a temporal muscle contracts before the other one, or one more than the other, then consult your dentist. These problems can cause migraines, temporal scalps, ophthalmologic migraines, or dizziness. Muscular control. The control of the muscles of the jaw. A problem of the jaw muscle can cause headaches, blurred vision, buzzing ears, pain in the back, and tendinitis. Muscular control. The control of the muscles of the jaw. A problem of the jaw muscles can cause headaches, blurred vision, buzzing ears, pain in the back, and tendinitis. Control of the movements of the jaw. Let's take the opening and closing test of the jaw. For this test, you should stand up before a mirror. Cecile, put the hands to each side, just before the ears. Open up and close the mouth slowly. If you notice deviation in the closing, it is a sign of a problem with the articulation of the jaw. In that case, you should consult your dentist. Pain in the articulation of the jaw can cause dizziness, migraines, and ear buzzing. A displacement of the jaw can cause tension in the neck, imbalance backwards, and back pain. If you notice a discrepancy and pain in the jaw, you should consult your doctor, physiotherapist. The control of the movements of the jaw. A curvature of the opening of the mouth can cause pains to the head, the hips, knees, feet, dizziness, and ear buzzing. You should consult your doctor, dentist, a physiotherapist, osteopath, podiatrist, or another supra-daul professional. Proning control. Let's carry out the test of feet support. For it, Cecile, you will lift a leg and we will see if there is a too strong support of the big toe, or if there is a hole. It is absolutely necessary either to have a piece of furniture or a near person in order to avoid falling. Therefore, Cecile, lift a leg. The normality is to have the support distributed in the external area of the foot and toes. When we find a too pronounced hole, what we call hollow foot, or a too strong support in the area of the big toe or the heel, the risk is that of destabilizing the body, causing ankle fatigue, fatigue of the knee, or torsion of the pelvis and the femur in fact. If you find a balance problem or of support to the floor, you should undoubtedly consult a podiatrist who knows the supra-daul method. A proning problem can cause pains, feet, ankles, knees, hips, vertebral spine. Consult your doctor or supra-daul podiatrist. Ballerina test. Cecile, let us do the ballerina test. In order to do so, it is necessary to put the arms in crown. We also have to put the feet at the level of the shoulders and to maintain this position during 2 minutes. From that, we will be able to feel if there are pains at level of the head, neck, shoulders, back, legs, knees, or feet. In this position, little by little, pains will appear and you should memorize them. This test can determine if the body is well balanced. If we find pains at this level, then you should go to a practitioner familiarized with the supra-daul method. You may consult us to keep informed on our formation or any other question. Contact with the center. Acknowledgements. With thanks to all those who participated closely or from a distance with the production of this DVD, the patients for their testimony. A special acknowledgement to Abiel Solomon, Director of AM Productions, for his involvement and valuable support. Teleson for the authorization to Mr. Patrice Arditi for broadcasting his program. Sandrine Friends for his perceptive interview. Eddie Champenois, Arnaud Libert, and Cécile Bois for the quality of the direction and editing. Stephen Solomon for the excellent work as trainer.